Good morning students. Today's class we will see about the normal mechanism. The definition of mechanism of labor. As the fetus descends, the soft tissues and the bony structures exert a pressure on the birth canal by a series of passive movements. Collectively, these movements are called as the mechanism of labor. It is a series of movements that occur in the fetal head and its trunk in the process of adaptation during its journey through the pelvis. The principles common to all mechanisms are: first one, descent takes place throughout the labor. Whichever parts leads and first meet the resistance of the pelvic floor will rotate forwards until it comes under the symphysis pubis. And third one, whatever emerges from the pelvis will pivot around the pubic bone. Today, we are going to discuss LOA or left occipital anterior. So, the lie is longitudinal. The presentation is the cephalic. Position is left occipital anterior. That means the occiput point towards the left iliopectinean eminence. Attitude is one of the good flexion. Denominator is the occiput and presenting part is the posterior part of anterior parietal bone. The main movements are descent, flexion, internal rotation of the head, extension of the head, internal rotation of the shoulder and lateral flexion. So first one is descent. According to the first principle, descent takes place throughout the labor. In a primary mother, the descent takes place 2 weeks before the onset of labor, that we call as a lightning. But in a multigravida, the descent may takes place after starting after the onset of labor. It is because of the lax muscle tone. And second is flexion. This increases throughout the labor. Fetal spine is attached near the posterior part of the skull. Pressure exerted down the fetal axis will be more forcibly transmitted to the occiput than the sinciput. At the onset of labor, suboccipital frontal diameter 10 cm is presenting. Greater flexion extends to suboccipital brecmantic, that is 9.5 cm presence, and occiput is the leading part. Third is internal rotation. Occiput is point towards the left iliopectinean eminence and occiput is the leading part. So, according to the second principles, whichever part leads and first meet the resistance of the pelvic floor will rotate towards and it comes under the symphysis pubis. Here occiput is the leading part. The occiput come and touches the left iliopectinean eminence, or it is point to the first touch come to the pelvic floor first. So the occiput rotate anteriorly and comes under the symphysis pubis. You have to keep in mind only the occiput will be rotating. The occiput rotate and it comes under the symphysis pubis. So you can see there is a slight twist in the neck of the baby fetus will be happen. This causes slight twist in the neck of the fetus as the head is no longer in direct alignment with the shoulders. The anteroposterior diameter of the fetal head now is in the anteroposterior diameter of the pelvic outlet, which helps in the easy escape. The occiput slips beneath the pubic arch and the crowning occurs. Crowning means after the uterine contraction, the fetal head will not recede back. So, the occiput slips beneath the subpubic arch and crowning occurs. That means head no longer recedes between the contraction and widest transverse diameter, that is the biparietal diameter is born. The fourth movement is extension of the head. Once the crowning occurs, the fetal head can be extended, pivoting on the suboccipital region around the pubic bone. This releases the sinciput. Face and the chin, which sweeps the perineum, and the head is borne by the movement of extension. Next is restitution. The third principle says whichever emerges from the pelvis will pivot around the pubic bone. So restitution occurs, the twist in the neck of the fetus, which resulted from the internal rotation, is now corrected by a slight untwisting movement. slight and twisting movement. This occiput moves 1/8 of the circle towards the side where it is originally started. Next is internal rotation of the shoulder. Shoulder enters the occiput in the left oblique diameter and the anterior shoulder point towards the right iliopectinean eminence. So, the anterior shoulder rotates anteriorly and comes under the symphysis pubis. At the same time, the head will be rotating externally. So, the anterior shoulder sweeps under the symphysis pubis and the posterior sweeps under the symphysis pubis and posterior shoulder sweeps the perineum and the body is borne by the movement of lateral flexion. So, these are the main movements which occurs in the mechanism of labor.